The St. James Health Department says it stands ready to prevent the spread of the deadly hantavirus should it reach the island. Health Department on the high alert of hantavirus. Speaking at Thursday's Municipal Corporation monthly meeting, Medical Officer of Health for St. James, Dr. Francine Phillips-Kelly, noted that the vigilance in watching for any spread of the disease is especially important since Jamaicans are among the world's most frequent overseas travelers.
Zoonotic viral respiratory disease, and it's caused by Hantavirus. We are keenly aware of this situation, and we have to remain vigilant because, as we all know, St. James is an active cruise ship destination. And our neighbors in Trelawney also.
The hantavirus is usually spread to humans through contact with the urine, feces, or saliva of infected rodents, particularly rats. In the meantime, Dr. Phillips-Kelly revealed that the Pan American Health Organization has issued regional advisories for other diseases, including measles and dengue.
Communicable and non-communicable surveillance, and we have in the Ministry of Health and Wellness had to have heightened surveillance because of outbreaks that are happening not too far away from us. There are measles, chikungunya, influenza A, influenza B, respiratory syncytial virus, dengue. All have been alerted by the Pan American Health Organization, and as members of that community and the region of the Americas, we remain on high alert.